Welcome back. We're continuing the news. Now, in this evening's edition of the Health Report, Shamila Pullen looks at Candida Auris.
A fungal superbug called Candida auris is spreading rapidly through hospitals and nursing homes in the U.S. Candida auris is an emerging fungus that presents a serious global health threat. Although concerned, the Centers for Disease Control and Prevention, CDC, has not been tracking deaths related to the condition. But what's certain is that a number of people have been getting sick, partly because it is resistant to multiple antifungal drugs commonly used to treat the infections. Infectious diseases consultant at the University Hospital of the West Indies, Dr. Kathy Pate Robinson, says medical experts suspect there are cases in Jamaica.
The challenge is that we don't have good fungal testing. So we can't do in-house, in the island, a lot of the fungal identification tests. And that's perhaps more of a resource limitation. Testing is a lot more expensive for those kinds of germs. And so we don't easily identify the funguses that we have. We have been expanding our testing capability as fast as we can, but we don't have endless funds, so we're still limited.
People who are very sick or who have long or frequent stays in healthcare facilities or a weakened immune system are at increased risk.
What we're seeing with Candida auris is it is often invading into the bloodstream. So then you get a bloodstream infection or a fungemia, and that could mean that anywhere that the blood goes in your body could be infected. So that could lead to a heart infection, an infective endocarditis, which is 100% fatal without treatment. And because this fungus is a lot harder to kill and also harder to identify.
The condition shows no signs or symptoms, but fever and chills are associated with it. Dr. Pate Robinson says drugs to treat Candida auris are expensive and are not readily available.
So that means that you might then have to order it from overseas. That will take time to come, and that is going to be at a significant cost. For one of the agents that's a little more available to us in terms of being able to, say, order it from Miami, you might spend between $600,000 and $1 million for one course of treatment. That's not available to the average person in the population.
Persons are encouraged to practice proper hygiene and wear face masks when possible. With our health report, I'm Shamila Pullen wishing you good health.